Hello. We want to help you limit the amount of alcohol you drink as part of a healthy, balanced lifestyle. The more you drink, the greater your risk of developing serious health problems. Alcohol is processed by the liver, but it can only cope with so much at a time. Drinking too much alcohol can damage liver cells and produce toxic chemicals. This can lead to inflammation and permanent scarring of the liver. Alcohol is also linked with a higher chance of developing heart disease and high blood pressure, as well as mental health problems such as depression and anxiety. Alcohol is associated with an increased risk of accidents. 1 in 7 road deaths are caused by drinking alcohol, and of course, alcohol is expensive. Therefore, cutting down can save you a lot of money each month. Alcoholic drinks contain a surprisingly large number of calories. In fact, a pint of beer contains the same number of calories as a large slice of pizza. Drinking also reduces the body's ability to burn stored fat. This all leads to large amounts of weight gain. To limit the health risks from alcohol, both men and women should drink no more than 14 units of alcohol per week. These units should be spread out over the week, and you should have at least 2 alcohol-free days. So, what is a unit? 1 unit of alcohol is equal to half a pint of ordinary strength beer, lager or cider, or a small pub measure of spirits. A small glass of wine is equal to 1.5 units. But remember, many wines and beers are stronger, so your drink may contain more units than you think. About 1 in 3 men and 1 in 7 women drink more than the safe levels. Many people are not addicted to alcohol, but for various reasons have got into the habit of drinking regularly and heavily. And remember, binge drinking can be harmful, even though the weekly total may not seem that high. Once people know the risks, they often find it easier to drink sensibly, and in other words, below the weekly recommended limits. If you're trying to cut down, here are some tips which may help you. 1. Reduce the number of days each week when you go out for a drink. 2. Try different social activities which don't involve drinking. 3. Pace your rate of drinking by alternating soft drinks with alcoholic drinks. 4. Consider drinking low alcohol beers, or at least avoid strong beers and lagers. 5. Try to resist pressure from people who may encourage you to drink more than you really want to. Signs of dangerous drinking habits include 1. Needing a drink every day. 2. Often drinking alone. 3. Needing a drink to stop trembling. 4. Neglecting your interests or hobbies because of drinking alcohol. If this sounds familiar, or you're finding it hard to cut down, why not make an appointment with your GP or practice nurse? They will be able to give you advice and direct you to support groups.